obviously the events in Orlando, I think, clearly have affected all of us in some way or another. And it made me feel some guilt. Like, how could I be talking about something like oral health when there's so many bigger problems or bigger issues and, really terrifying things happening around our country. So I just want to recognize that this is not to say that this issue is more important than all of the other issues our country's facing, but it is an issue that continues to be ignored, and it's time. It really is time for us to take some action on that. I am just really thrilled to introduce really the data, some of the data from the report to you. And like I said, one of the most important things to us when we got this heavy dense data, 100 pages, we were like, how are we going to turn this into something people are interested in? Because I know y'all love to read about oral health, but not as much as I do probably. So looking at healthcare statistics in Santa Cruz County, you might think that everyone is being taken care of. For example, you may think that the passing of the Affordable Care Act means that everyone now has health insurance and can get all the care they need. But it's important to think about this issue much like a dentist does in caring for patients. When dentists observe a patient's mouth, they know there are problems beneath the surface that they may not see at first glance. These below the surface problems often set off a cycle of issues that lead to bigger ones. In our community, we have some glaring social problems like homelessness, drug use, and lack of employment. And many people are very aware of them. But what's hiding under the surface? And what prevents these problems? Well, for one, good health. And you cannot have good health without good oral health. So many people may not know this, but having insurance does not equal access to care. Yes, almost 80,000 people will be covered by Medi-Cal in Santa Cruz County this coming year, but only 25,000 people were able to access services in 2014, as Barbara mentioned. That's 1 out of 3. That's 50,000 Medi-Cal patients that couldn't go to the dentist. In Santa Cruz County, the use of dental services by Medi-Cal adults is particularly distressing. Only 18% of working age adults visited the dentist. As for children's utilization rates, a full 31% of Santa Cruz County children have never been to the dentist, and 24% of pre-K children screened had evidence of untreated decay. The problem is even bigger than these numbers imply. They don't include the tens of thousands of uninsured people in our community, working families, some of whom are undocumented, others who just don't qualify for subsidized programs, and those on Medicare. Medicare does not meet seniors' dental needs, and seniors make up the fastest growing demographic in Santa Cruz County. So why are so many eligible people not going to the dentist? A major reason is the availability of dentists who take Medi-Cal. There's only 10 private offices out of 58 in Santa Cruz County that take public insurance. Half of them are specialty providers, and only a few are taking new patients. It's also important to note that the Santa Cruz County dental clinics, the safety net, they serve a great number of these patients already, but we're all at full capacity. For specialty care, it's even worse. Take dental anesthesia services, for example. If you're a publicly insured Santa Cruz County resident and you need dental anesthesia services for your child, you won't find anyone in Santa Cruz County to offer it. The closest office is in Salinas. Or if your high school age teen has wisdom teeth growing in, until this year you wouldn't find an oral surgeon to extract them, even if your child was in pain. You could drive to Hollister or San Francisco, but even then there's a 3-month waiting list. This lack of adequate access to dental care is unacceptable, especially given that oral health impacts overall health, employment opportunities, and just general social connectedness. So you might say that the mouth is the gateway to your body and a window to your health. It can signal what other health issues may be present. That's why integration of dental and primary care is already happening in health insurance plans and clinics across the country. Over the past decade, evidence has shown a link between oral disease and, as Barbara mentioned, diabetes, adverse birth outcomes, cardiovascular disease, Alzheimer's, and strokes. Your mouth can also indicate whether you're suffering from other less serious conditions, such as anemia, a vitamin or trace element deficiency, or various viral and bacterial diseases. But maybe most importantly is the growing appreciation for the psychosocial impact of poor oral health. Homelessness and behavioral health are big issues in Santa Cruz County. But without access to dental care to support people here, how do we expect them to find a job, to get housing, or even just speak, chew, and socialize? Oral health affects whether people can find employment, whether kids get teased or speak up in school, and so much more. Because many diseases can be caught early by looking at oral health conditions, dental care is a key component of preventative health. In fact, studies show, as I mentioned, a link between inflammation of the gums and heart health. Imagine preventing dental disease through good oral health habits could also reduce the likelihood of you having a heart attack. Yet so few people, even doctors, know or acknowledge this. It's particularly important to provide children with dental care services to prevent dental disease and related conditions later on in life. Studies have shown that increased access to oral health for children leads to an adult population with decreased dental disease and decreased need for care. And as I mentioned earlier, poor oral health can cause low birth weight babies, and it can also indicate other serious conditions such as Alzheimer's and diabetes, both of which are chronic and deadly diseases that cost our nation millions. The bottom line is, if we believe in prevention, we have to believe in access to dental care. And good oral health affects employment. In a 2006 study, researchers gave nearly 400 welfare recipients with severe dental problems oral health care. Those who completed their dental treatment were twice as likely to get jobs and get off welfare than those that didn't. As former president of the California Dental Association, Lindsay Robinson said, customer service jobs, good entry-level jobs, just aren't available to people who lack the basic ability to smile. So we all care about health, but many people often don't treat dental issues with the same importance as health issues. This can be due to lack of understanding about its importance, as well as anxiety about going to the dentist. But when you think about it, we would never treat our general health the same way we treat dental care. Would you not take your new baby to their first visit to a doctor? Yet many don't know the value of taking their 1-year-old to the dentist. Today, only 29.5% of dentists see children by their first birthday in Santa Cruz County. If we helped educate the public about the benefits of taking your child to the dentist and good oral health habits, we could change the trajectory of thousands of lives. So I have a story taken from a safety net clinic in the community about someone's life who was negatively affected by his poor oral health. Michael is a veteran. He is also unemployed, uninsured, and homeless. Before coming to the clinic, he hadn't had dental work done in years. The delayed care hindered his ability to eat properly and get a good night's sleep. The pain in his mouth had forced him to resort to drinking his meals through a straw. And when we first met him, he said, I'm going to get my life back on track, and fixing my teeth is my #1 priority. Why didn't he say getting a job or access to housing? He said because the pain was overwhelming him, controlling his whole life, and he couldn't better his living circumstances until he had access to basic dental care. The clinic was able to give Michael the care he needed, and it helped change his life. But thousands in our community can't get the care they need. So remember the slide earlier that showed only 25,000 people accessed dental services in 2014, and that was out of 80,000 eligible patients. Here you can see the disparity in dental care service utilization, with only 18% of Medi-Cal adults receiving services. But it's not just working age adults who are affected by this access problem. Seniors on Medicare have no dental benefits at all. Many at this age are putting off getting a procedure done and instead just coping with pain and discomfort. This can complicate their other health conditions or interfere with getting adequate nutrition. The Santa Cruz County Area Agency on Aging notes that access to affordable dental care is the #1 issue for seniors surveyed in our community. Chances are all of us will be personally impacted or know someone impacted by this dental service access and utilization problem. So the good news is, there's good news. Lack of access to dental care and oral health education can be solved. Today, 85% of current dental care providers in Santa Cruz County have some capacity to see new patients, including publicly insured ones. Safety net clinics are making plans to grow and add capacity to serve more people, and primary care providers can play a role too, during well baby visits, for example, by providing oral health education and fluoride applications. Even if you're not a dentist or primary care provider, you can have a major impact. I mentioned earlier that 24% of children in reporting school districts in Santa Cruz County showed evidence of untreated dental decay. This is just one example, but think about the impact that primary school educators could have if they raised awareness with parents and children about the importance of good oral health. Many community groups are also taking note of our data and seeing the connection between dental care and other social issues such as homelessness and drug use. People like our patient Michael can only get their life on track if they take care of their dental issues and are out of pain. Oral health needs and its impact on other social problems has been ignored for too long. We need to take action now, but we can't do it alone. The data shows we have a big problem around oral health in Santa Cruz County, but it's solvable. Whether you're a dentist or not, you can help the dental care access and oral health awareness problems in our community. And we've assembled a team like you for a very specific reason. You have a unique set of talents and perspectives and responsibilities in this community. We need your ideas on how you can influence your world to make dental care more widely accessible to all in Santa Cruz County. Our collective efforts at improving dental care access will have a ripple effect, and it starts here today with you. So we look forward to hearing your ideas, and thank you again for being here.